Hi there, welcome along. My name is Paul Gough. I'm one of the UK physios. Today I've been asked to talk about runner's knee, or you might know it if you've had it before, if you've looked it up, as ILIOTIBIAL-BAND syndrome, ITB. But more commonly it's known as runner's knee because, as it suggests, it's very common in runners. It's an injury which is extremely painful. It's very common. It's very common in riders as well as runners, and it's an injury that we see, believe it or not, in our physio clinics a lot more in summer. Obviously, light nights, people are tending to be more active. They like to get out into the streets, so somewhere like Durham or Guisborough, Hartlepool, people are out. They like to be doing things, and running is usually one of the best and most popular ways to keep fit in the summer. So it's an injury that we see a lot of in the summer. So today I'll talk to you about what a runner's knee is, or an IT band problem is, why it is a problem, why it causes you the pain that it does, and also why it's a problem in terms of it's likely to be causing you a restriction in your fitness activity. And we'll also look at how physiotherapy can help you. This is a quick introduction to who I am. That's me in my office here in Hartlepool. My previous career, I used to work with Darlington and Middlesbrough Football Club here in the Northeast as a physiotherapist for those two football clubs. And I've also done a little bit of work abroad with people like Paul Scholes in America, working at the Manchester United Footballers Soccer Academy. So, and believe it or not, these injuries, as much as it's a runner's knee or a very common in a bike rider type injury, it's also a big problem in sport, in football as well, or somebody who's just generally trying to get fit for their football. So it might be that you're a badminton player or a squash player, but you've increased your running activities lately in an attempt to be fitter. Runner's knee is a problem for people just generally trying to get fit for their sport. And before we do all that, I'm going to talk to you about the real problem with a runner's knee. It's often a weakness of your lower back muscles. We talk to people all the time about problems with ITB being caused by the gluteal muscle, which is the big bum muscles that you've got. If they don't work properly, it means that when your knee lands, it's not getting the support or stability that it needs from the muscles above. So we also need to look at your lower back, and we look at the strength, and we call it core stability. And with this type of problem, we may be trying to encourage you to do things like Pilates, core stability, balance ball exercises, which you've probably seen people doing in the gym. So we'll talk about that as well as we go along, and obviously particularly from a physio sort of session point of view, those are the things that we look at when you do come in for your treatment. So it's a common injury in the summer, and like I say, particularly for runners and for riders, ITB band problems are just that, they're a problem. But first, let's confirm that you do actually have this injury. You're likely to be having pain and burning on the outside of your knee. Now, if you have a quick look at the image on the left, that's the IT band, the white thing, that fascia as it's called. That's the band, and it runs obviously from your hip, and the muscle that you can see is the big glute, the big bum muscle. Hamstrings are at the back, and where I've highlighted there, the blue section, that's usually where a person will feel the pain on the outside of their knee. So you can see, and you might be able to even feel on the outside of your knee now exactly where you're getting the pain. That usually correlates to where I've put that blue circle there. Pain is often worse when running or riding, so when you do go for your run or you do go for your ride, that pain comes back. You might think that it was fine when you first started off, you've had some rest, the pain comes back usually round about at the same point, and then all of a sudden it just gets earlier and earlier and earlier. Pain comes on gradually and is nearly always worsening. Like I've just said, it'll get to a point of maybe 20 minutes into your run where you'll feel that pain, and it just will stay. It will not go. There's nothing you can do. You can't run it off. You come back in, you go for a walk, and you put your ice on and you rest. That pain usually goes, and that's a good sign of an IT band problem. And one more sign. What we call this thing is exercise induced. So when you're resting, so when you're watching this video right now, you may not have any pain in your knee, but when you get back to activity, you get back to your running, you get back to your riding in Guisborough, you get back to your running in Durham or Hartlepool or wherever it is that you're watching this video, you will get pain that comes back on when you're exercising. Okay, and if you have a quick look on the image, that's the outside of your knee, and when your knee bends, that's called knee flexion. That is the point. So it's also common in people who weightlift. So there's, imagine doing some squats in the gym, bike riding because your knee bends, and obviously running because your knee bends. So at that point, your knee is in what we call knee flexion, and that stretches the band in quite a severe way. So it basically means that that band is running over the side of your knee and causing you pain. So what is the iliotibial band, or the ITB? It's basically a thick fascia which runs down the outside of your leg, and its main job is to stabilize your knee, and it's nearly always an overuse injury. It's very unlikely that you damage this through like a typical strain or a trauma or an accident. It's nearly always because of an overuse or a weakness of the muscles above and below it. And the best way I can explain this to you, to get you to think about it, think of elastic band. If you pull an elastic band really tight, it will probably begin to fray. And if you keep pulling it and keep pulling it, eventually it would snap. Now, it's unlikely to happen with the band that it would snap, but it's very likely that it frays, particularly as it glides over the side of the knee. And as it glides over the side of the knee, it gets inflamed. They put down scar tissue. The scar tissue is really thick. It's kind of like a glue or a cement. It gets tighter and tighter and tighter. And this band just feels as though it just doesn't want to give up. And it's so stiff and so tight that it almost doesn't want to let you run. And a good indicator as well of a person with an IT band problem is that they've had a previous knee injury. Perhaps you've just had surgery, you've had a problem in the past with one of the muscles, and the muscle on the inside, the big muscle, as you look inside your knee, isn't quite as strong as it should be. And from a physio point of view, that's one of the first things that I look for, is I look for the stability, the strength, and the control of the quad muscles as a good indicator of how likely it is that an IT band problem will remain. So why pain and restriction? Well, the fibers get torn, they get broken down, and it's not quite as strong as it was. So your body will put down scar tissue. These things just do not react nicely to scar tissue. And as it gets tighter, you're on this kind of vicious circle that as this band is getting pulled tighter and tighter, it's more likely to glide over the side of the rough surface of the knee, which creates more inflammation, more pain, and this band gets tighter. You might get a little bit of swelling around there, and that again can stop the knee from moving around. And that does want to stop you from running. It wants to stop you from bike riding. And often you find with these bands, they don't recover properly. They heal wrong, as with most muscles and most fascia. They just don't recover properly unless you're given the right advice, the right exercises, and the right hands-on treatment to begin with. So physio can help. You might have found this already. Stretching is actually really difficult to do on your own, and there's lots of confusion as to which exercises and which stretches you should be doing for the runner's knee or for the iliotibial band problem. But we'll show you that when you come in to see us. You definitely need hands-on treatment. And if you have a quick look at the image there, that's an example of one of the exercises that we would give you specifically. Obviously, we talk you through it and give you the sheets on how to stretch that iliotibial band. But you need hands-on treatment. We'd have to work right the way up the band. It is a little bit uncomfortable, a little bit painful, but nothing that doesn't feel great, particularly when we're finished. We'll explain to you exactly how it's happened to you, and if that problem is caused by the glutes or the lower back muscles, or possibly by trainers or poor fitting footwear, or a foot that rolls in slightly. We will look at that to see if that's causing a problem, and also obviously the other muscles such as your glutes and your hamstrings, because if they don't work properly, it's very unlikely that your knee will work properly, which means that your iliotibial band is more likely to be injured. And obviously exercises to do at home, they are vital, and it's vital that you do the right ones, which we'll explain you how to do. And also the big thing, the real value for money in physio, if you ask me, we'll guide you through a safe return to activity. Lots of people try to get back to activity too soon, or they'll rest for a week and they'll start up again, and it just isn't safe to do. So that pain will come back within a week or so, if not pretty quick, if not even sooner. So from a physio point of view, we'll tell you what you can be doing, and we'll also try and advise on other things that you can do. Maybe that you can go swimming, you can do certain types of stroke. You might be able to get back on the bike. It just means that you need to change the position of your seat so that the angle changes, so that there's not as much bend going on at your knee. Or we'll talk to you about lowering the gears or staying on the flat. So we'll try and get you back to doing things as quickly as possible. One thing we do encourage with this type of injury is Pilates style exercises. So if you are a keen runner or a keen rider, think about Pilates exercises, because they're going to be able to help you in the long run. So to get back to running, it'll probably take about 3 to 4 weeks, usually about 3 or 4 sessions. You need lots and lots of deep massage, lots of stretches, which we'll show you both in clinic and stuff for you to do away as well, and the right exercises. You can see there that in between your knee is your foot and your lower back, and we look at both of those. So it's really important to have the right balance, the right control, and the right muscle work going on to minimize and reduce the risk of injury to this iliotibial band. So we'll do that for you as well. We're in Darlington, Durham, Guisborough and Hartlepool, and if you wanted to come and visit us, we always offer this promise. We'll give you your session free if physio can't help. So if you make your appointment to see us and it turns out that it isn't an injury that we can treat, and we can't help you and we can't give you value for money, we don't charge you, but we'll always try and tell you exactly what you've done and who the best person is to see. That image there is of one of our clinics in Hartlepool. So if you want to come and see us, we're in Darlington, Durham, Guisborough and Hartlepool, right around the northeast. And the number you need to call and book your session, we can usually get you in within a couple of days, is 0800 043 8671. And just to confirm, physio can definitely help an iliotibial band problem or a runner's knee type problem. You need hands-on treatment, you need an explanation of your injury and somebody to look above and below the injury. Definitely exercises to do at home to work on your lower back and also the balance of your knee, and also we'll tell you exactly when it's safe for you to return to the sport that you love to do. So please give us a call. We can definitely help you with this injury, and if you want to speak to one of our physios even before you do call, before you do book your appointment, please feel free to do so. The number you need is 0800 043 8671, and that gets you through to any of our clinics here in the northeast. That's it from me. Thanks for watching. Take care. Hopefully see you soon.